everybody. I'd like to welcome you back to the Mental Health Detox. My name is Caroline Baker, and I'd just like to welcome you back. And, I had to take a break for a while, y'all. This was life before me. So I'm back with this video on the top 5 things you need to look for when seeking mental health care. I get a lot of questions about, just from family, friends, and, people I just come across they know they need mental health care or a family member may need some type of mental health treatment, but they don't really know kind of where to go or where to start or even how to go about doing it. And so I compiled this list of the top 5 things that you need to look for when you're seeking mental health care. First, understand what type of care are you looking for? Are you looking for a therapist? You just want to talk about certain problems that are going on in your life, whether it's grief, marriage, issues with your kids, or you're kind of just dealing with depression and anxiety and want to learn how to cope through certain things and changes in life, therapy may be a good benefit. However, if you're needing to couple that with say, hey, I'm open to trialing medications to help me really overcome some of these obstacles or these challenges, that may be a different provider. Or if you're needing treatment for substance addictions, the provider type may change. So identify what is the type of care that you need. If the care is not directly for you, it may be for a adolescent or a child. You want to make sure you find a provider that specializes in that target area, or there's a family therapist or a family nurse practitioner or a family psychiatrist. It may be for someone who's elderly, and so they have specializations for that. So just understand, in this field of mental health, there are several layers to, the type of treatment that we can provide and several specialties within mental health. And so identifying, okay, what type of care is it that I need, will help you drill down where to look. Tip number 2, the availability of the provider. This is a big one because a lot of times I hear, people say, hey, I made an appointment with such and such, and they can't see me for 2 or 3 months because they're booked up. And so again, when you find the right set of providers or people that you're looking for, ask them, what is their caseload? Do they have a lot of clients? Are they managing multiple sites? They may not just have an office here. They may have an office across town. They may have an inpatient practice in the hospital. And so they're busy. And so finding one that, like, hey, I can get in to see you when I need to see you. And if there is an urgent need for me to see someone in your office or see you, I can be able to do that in case I have a crisis situation. So checking their availability, looking at their caseload to say, hey, is this somebody that can meet my need? Tip number 3, do your research on these people. And when I say do your research, you're looking at their credentials. What is their education level? What is their specialty? You want to see how many years of experience they have, or if they target certain patient populations. You want to know if they have coverage to where, say, if you're going through something, or a family member is going through something, it's a crisis, they have admitting privileges to send you to the hospital. They can do that for you. Or if there's a legal situation going on, they can help you initiate legal matters and as relates to the mentally ill. So just kind of do your research on this person. And also look at their passions. Are they passionate about working in this field? Do they do any type of education, offer any type of resources, any community-based community service events that they offer? People who usually are heavily involved in the field that they work in give a lot to the profession. And so if that's the type of person that you are, or the type of person that you're looking for, you're likely to have a better match when you meet that person or you connect with that person, because they'll have so much more to offer you in addition to just your visit. So do your research, check them out, dig deep, see what they're passionate about, get to know them just as much as they're going to get to know you, and see if y'all are going to be a match. Tip number 4, which is probably the biggest one, where to look. Okay, so this I get a lot of, hey, who do you know that does counseling with teenagers, or who do you know that does substance use treatment? And where do I go to find that? So of course you can always start with a Google search, Google mental health places near me, and of course it's gonna bring up anything local. But also you could start with your insurance. So if you have an insurance coverage, call your provider and say, hey, who's covered under my plan and what is covered? That will save you a lot of time when it comes to seeing what can you afford to cover, and then also kind of who is in your realm. If insurance is good, you got like Blue Cross Blue Shield or something that's kind of generic, or I don't say generic, but widely accepted. Then there are lots of state funded mental health directories. So you can always go to your state website. Also, there's just general private owned mental health directories that providers can subscribe to and list their information for you to contact them. And so they offer a variety of services. Some of them do telehealth, some of them do in person, some of them do both. You just really figure out kind of what is it that you're looking for when you're trying to find and narrow down these people and what they offer. And so just looking kind of all over the place. But to me, honestly, the biggest, best, the most bestest, but the best way to find a mental health provider is word of mouth. You got people who've been navigating this system for a while now, and so they can tell you the who's who in the community, who's good, who's not, some of their experiences, what they know, where they work. They can point you in some directions and give you some leads. So just ask around, like, hey, who did you go to for grief counseling? Who did you go to for marriage therapy, couples therapy? Ask around. Don't be shamed. Please don't be shamed. Because we all struggle with something. A lot of us are out here struggling with depression and anxiety post-COVID. So everybody's out here looking for help. Some have been successful with achieving help. So why not ask? Save yourself a trip. Tip number 5. And so the last tip, I just want you to know that, it's going to take time to find the right match. That's perfectly okay. It is not uncommon that you may have to see a few people before you find the right person that's the right fit for you and it's going to provide the best care that you need. And it's also not uncommon that you have to see more than one person. So you may start off saying, hey, I just needed some therapy, but then I realized I need medication. And that further led me to realize I needed treatment for this PTSD or treatment for addiction or treatment for this. So you may find yourself seeing more than one person. And so there are larger clinics that can accommodate all your needs in one, all your mental health needs in one. And so, starting, just keep an open mind when you're going through this process. And it's perfectly okay that things change. As your needs change, the person may change as well. And that's part of being fluid with mental health. It's an ongoing battle. So, you got to keep at it and keep getting better with identifying your needs and identifying the person that's most appropriate to meet the need. I do want to leave you with one bonus tip, and I will share these resources in the description box, but just being able to identify in a time of a crisis, where can I go? And this may not be applied to you. It may be applied to your child. It may be applied to a friend, a neighbor, but what do I do in the heat of a moment and I have a mental health crisis? Of course, call 911. 2, you can always report to the nearest emergency room or crisis center. A lot of these bigger cities are starting to open mental health crisis centers, so you can report there. And then also just, looking at that provider that you pick. Do they have emergency type of treatment that they can offer? There are several crisis lines. There's one for suicide, there's one for veterans, there's one for elderly people, there's one for teenagers. All that I will link below so you have that information, but those are national lines. But just identify, like, what are my local resources in my area in case I have a mental health crisis? Where can I go? And what can I do? Who can I call? And again, I hope that this video was informative for you. I get a lot of questions about kind of what to do, where to go, and who to turn to. And so I'll share this video with as many people as you think could use it. And y'all subscribe to my channel, and I will be back in full effect once I have this second baby. Yay! And have more videos for you. All right, talk to y'all soon.